Welcome! Today, we're diving into the world of pulse oximeters, a small, handy device that's become a staple in many homes and healthcare settings. But what exactly does it measure, and why is it so important? In this video, we'll break down the basics, explain how to interpret the numbers you see, and discuss what those results can tell you about your health. Whether you're using a pulse oximeter for the first time or just want to understand your readings better, you're in the right place. Let's get started by exploring what a pulse oximeter actually is and how it works. A pulse oximeter is a small, non-invasive device that clips onto your fingertip, toe, or earlobe. It uses light to measure how much oxygen is in your blood, giving you a quick snapshot of your oxygen saturation level. This tool is especially useful for people with respiratory or heart conditions, as it helps monitor how well oxygen is being delivered throughout the body. The device is simple to use and provides results within seconds, making it a valuable tool for both medical professionals and individuals at home. Pulse oximeters work by shining two types of light, red and infrared, through your skin. The device then measures how much light is absorbed by the blood. Oxygen-rich blood absorbs more infrared light and lets more red light pass through, while oxygen-poor blood does the opposite. By analyzing these differences, the pulse oximeter calculates your blood's oxygen saturation, or SpO2. This process is painless and takes just a few seconds, making it ideal for regular monitoring. When you use a pulse oximeter, you'll typically see two main numbers on the display, SpO2 and pulse rate. SpO2 stands for peripheral capillary oxygen saturation, which is the percentage of oxygen-saturated hemoglobin in your blood. The pulse rate, measured in beats per minute, tells you how fast your heart is beating. Both numbers provide important information about your respiratory and cardiovascular health, helping you and your healthcare provider track changes over time. SpO2 readings are usually given as a percentage. For most healthy individuals, a normal SpO2 reading ranges from 95% to 100%. This means that 95% to 100% of your hemoglobin is carrying oxygen. If your reading falls below this range, it may indicate that your body isn't getting enough oxygen, which can be a sign of an underlying health issue. It's important to know what's normal for you and to consult a healthcare professional if you notice consistently low readings. The pulse rate displayed on your oximeter tells you how many times your heart beats per minute. For adults, a normal resting pulse rate typically falls between 60 and 100 beats per minute. Factors like stress, exercise, illness, or medication can affect your pulse rate. Monitoring your pulse rate alongside your SpO2 can provide a more complete picture of your overall health, especially if you have heart or lung conditions. Monitoring your oxygen saturation is crucial, especially for people with chronic respiratory or heart conditions. Low oxygen levels can lead to symptoms like shortness of breath, confusion, or even organ damage if left untreated. By regularly checking your SpO2, you can catch potential problems early and seek medical attention before they become serious. It's also helpful for athletes, people living at high altitudes, or anyone recovering from illness. Using a pulse oximeter is simple. Start by cleaning your hands and the device. Place the oximeter on your fingertip, making sure your hand is warm and relaxed. Sit still and wait a few seconds for the device to display your readings. Avoid moving or talking during the measurement, as this can affect accuracy. Once you have your results, remove the device and record your numbers if you're tracking them over time. Several factors can affect the accuracy of your pulse oximeter readings. Cold hands, nail polish, artificial nails, or poor circulation can all interfere with the device's sensors. Movement, bright light, or low battery can also cause inaccurate results. To get the most reliable reading, make sure your hands are warm, remove any nail polish, and sit still in a well-lit area. Always follow the manufacturer's instructions for best results. For most healthy adults, an SpO2 reading between 95% and 100% is considered normal. Athletes or people living at high altitudes may have slightly lower readings, which can still be healthy for them. If your SpO2 drops below 92%, it may be a sign of hypoxemia or low blood oxygen, and you should contact a healthcare provider. Knowing your normal range helps you recognize when something might be wrong. A low SpO2 reading, typically below 92%, can indicate that your body isn't getting enough oxygen. This can be caused by conditions like chronic obstructive pulmonary disease, COPD, pneumonia, asthma, or even COVID-19. Symptoms may include shortness of breath, rapid heartbeat, or confusion. If you consistently see low readings, it's important to seek medical advice to determine the underlying cause and get appropriate treatment. A high SpO2 reading, close to 100%, generally means your blood is carrying as much oxygen as possible. This is usually a good sign, especially for healthy individuals. However, Extremely high readings are rare and can sometimes be due to device error or improper use. If you have a lung condition and your SpO2 is unusually high, consult your healthcare provider to ensure your readings are accurate and appropriate for your situation. Your pulse rate can vary throughout the day depending on activity, stress, and overall health. A normal resting pulse rate for adults is between 60 and 100 beats per minute. If your pulse is consistently above or below this range, it could indicate an underlying health issue. Always consider your personal baseline and consult a healthcare provider if you notice significant changes or have symptoms like dizziness or palpitations. Pulse oximeters are useful in many situations. People with chronic lung or heart conditions may use them to monitor their health daily. They're also helpful during respiratory illnesses, after surgery, or when adjusting to high altitudes. Athletes sometimes use them to track oxygen levels during training. If you're unsure whether you need to use a pulse oximeter, ask your healthcare provider for guidance. During the COVID-19 pandemic, pulse oximeters became especially important for monitoring oxygen levels at home. COVID-19 can cause silent hypoxemia, where oxygen levels drop without obvious symptoms. Regular monitoring can help detect problems early, prompting timely medical intervention. If you have COVID-19 or are caring for someone who does, using a pulse oximeter can be a valuable part of your care routine. Pulse oximeters can also be used for children, but it's important to use pediatric devices or sensors designed for smaller fingers. Children's normal SpO2 and pulse rates may differ from adults, so always refer to pediatric guidelines. If you're monitoring a child's oxygen levels, consult with a pediatrician to ensure you're interpreting the results correctly and using the device safely. For older adults, pulse oximeters are a valuable tool for monitoring chronic conditions and detecting early signs of respiratory distress. Elderly individuals may have slightly lower normal SpO2 levels, especially if they have underlying health issues. Regular monitoring can help catch changes early and support better management of health conditions. Always discuss any concerns with a healthcare provider. Athletes sometimes use pulse oximeters to monitor how their bodies respond to intense exercise or high-altitude training. Tracking SpO2 can help optimize performance and recovery. However, athletes may have lower resting pulse rates and slightly different normal ranges, so it's important to understand what's typical for your body and training level. Living or traveling at high altitudes can affect your SpO2 readings. The air contains less oxygen, so it's normal for your saturation levels to be slightly lower. Your body may take time to adjust, and monitoring SpO2 can help you track your adaptation. If you experience symptoms like headache, dizziness, or shortness of breath, check your readings and seek medical advice if needed. While pulse oximeters are helpful, they have limitations. They can't diagnose specific conditions or replace professional medical advice. Factors like skin pigmentation, poor circulation, or incorrect use can affect accuracy. Always use the device as directed and consult a healthcare provider if you have concerns about your readings or symptoms. Some people believe that a normal SpO2 guarantees perfect health, but that's not always true. Pulse oximeters only measure oxygen saturation and pulse rate. They don't detect all health problems. It's possible to have a normal reading and still experience symptoms that require medical attention. Use your pulse oximeter as one tool among many for managing your health. Keeping a log of your pulse oximeter readings can help you and your healthcare provider track trends over time. Note the date, time, SpO2, and pulse rate, as well as any symptoms you're experiencing. This information can be valuable for managing chronic conditions or identifying changes that need medical attention. Many devices also offer digital tracking or smartphone apps for convenience. If your SpO2 drops below 92%, or if you experience symptoms like severe shortness of breath, chest pain, or confusion, seek medical attention immediately. These could be signs of a serious health issue that requires prompt treatment. Don't rely solely on the device. Always listen to your body and consult professionals when in doubt. When selecting a pulse oximeter, look for devices that are FDA approved or meet recognized medical standards. Consider features like display clarity, battery life, and ease of use. Some models offer additional features like alarms or smartphone connectivity. Read reviews and consult your healthcare provider if you're unsure which device is best for your needs. To keep your pulse oximeter working accurately, clean it regularly according to the manufacturer's instructions. Store it in a dry, safe place and replace batteries as needed. Avoid dropping or exposing the device to extreme temperatures. Proper care ensures reliable readings and extends the life of your device. In hospitals, pulse oximeters are used to monitor patients during surgery, in intensive care, or when managing respiratory conditions. Medical-grade devices may offer more advanced features and higher accuracy. Hospital staff are trained to interpret readings in the context of each patient's overall health, ensuring appropriate care and intervention when needed. At home, pulse oximeters are a convenient way to monitor your health, especially if you have chronic conditions or are recovering from illness. They empower you to track changes and communicate more effectively with your healthcare provider. Remember, home devices may be less precise than hospital-grade equipment, so always use them as a supplement to professional care. If you travel frequently, especially to high altitudes or remote areas, bringing a pulse oximeter can help you monitor your oxygen levels and adjust to new environments. Make sure your device is charged and packed safely. Knowing your SpO2 can give you peace of mind and help you respond quickly if you experience symptoms of altitude sickness or respiratory distress. Some people use pulse oximeters to monitor oxygen levels during sleep, especially if they have sleep apnea or other breathing disorders. Overnight monitoring can reveal drops in SpO2 that might not be noticeable during the day. If you suspect sleep-related breathing issues, discuss overnight monitoring with your healthcare provider for proper diagnosis and treatment. For people with respiratory illnesses like asthma, COPD, or pneumonia, pulse oximeters are essential for tracking oxygen levels and managing symptoms. Regular monitoring can help detect flare-ups or worsening conditions early, allowing for timely intervention. Always follow your doctor's advice on how often to check your readings and what numbers to watch for. People with heart conditions can benefit from pulse oximeter monitoring, as it provides insight into how well the heart is delivering oxygen to the body. Changes in SpO2 or pulse rate may signal the need for medical attention. Regular monitoring, combined with other health checks, supports better management of heart disease and related conditions. Anemia can affect oxygen delivery in the body, but pulse oximeters may still show normal SpO2 readings because they measure the percentage of oxygenated hemoglobin, not the total amount. If you have anemia, discuss with your doctor how to interpret your readings and whether additional tests are needed to assess your oxygen status. Pulse oximeters cannot distinguish between oxygen and carbon monoxide bound to hemoglobin. In cases of carbon monoxide poisoning, the device may show a falsely high SpO2 reading. If you suspect exposure to carbon monoxide, seek emergency medical care immediately, regardless of your oximeter reading. Wearing nail polish, especially dark colors, can interfere with the pulse oximeter's sensors and lead to inaccurate readings. For best results, remove nail polish or use a different finger without polish. Artificial nails can also affect accuracy, so be mindful when choosing which finger to use for measurement. Cold hands can reduce blood flow and make it harder for the pulse oximeter to get an accurate reading. If your hands are cold, warm them up before using the device. This simple step can help ensure you get the most reliable results possible. Movement during measurement can cause the pulse oximeter to give fluctuating or inaccurate readings. Always sit still and avoid talking or moving your hand while the device is working. This helps the sensors get a clear signal and provides more accurate results. Skin pigmentation can sometimes affect pulse oximeter accuracy as the device relies on light passing through the skin. Some studies suggest that people with darker skin may get slightly higher readings than their actual oxygen saturation. Be aware of this limitation and consult your healthcare provider if you have concerns about your results. Poor circulation, due to conditions like Raynaud's disease or vascular problems, can make it difficult for the pulse oximeter to detect a strong signal. If you have poor circulation, try warming your hands or using a different finger. If you continue to have trouble, talk to your healthcare provider about alternative monitoring methods. Bright ambient light, such as direct sunlight or strong indoor lighting, can interfere with the pulse oximeter's sensors. For best results, use the device in a shaded or moderately lit area. Shielding the device from bright light can help ensure more accurate readings. A low battery can affect the performance and accuracy of your pulse oximeter. Always check the battery level before use and replace or recharge as needed. Keeping your device powered ensures you get consistent and reliable readings every time. Proper placement of the pulse oximeter is key for accurate readings. Place the device on the fingertip, making sure it fits snugly but not too tight. Avoid using the thumb, as it may give less reliable results. If you have trouble, try a different finger or follow the manufacturer's recommendations for placement. Some pulse oximeters may require periodic calibration to maintain accuracy. Check your device's manual for instructions on calibration and maintenance. Regular calibration ensures that your readings remain reliable and that the device continues to function properly over time. Some pulse oximeters come with alarm features that alert you if your SpO2 or pulse rate falls outside preset ranges. These alarms can be helpful for people who need continuous monitoring, such as those with serious health conditions. Set your alarm thresholds according to your healthcare provider's recommendations. Many modern pulse oximeters can connect to smartphone apps, allowing you to track your readings over time and share data with your healthcare provider. These apps can provide graphs, reminders, and additional insights to help you manage your health more effectively. Always use apps from reputable sources and ensure your data is secure. To wrap up, pulse oximeters are valuable tools for monitoring oxygen saturation and pulse rate, providing quick and non-invasive insights into your health. Understanding what your readings mean and knowing how to use the device correctly can help you manage chronic conditions, respond to health changes, and communicate more effectively with your healthcare provider. Remember, while pulse oximeters are helpful, they're just one piece of the puzzle. Always consult a medical professional for diagnosis and treatment. Thanks for watching, and stay healthy.